All right. Well, it's 12 o'clock and we want to be respectful of everybody's time. So I'm going to kick us off. I'm Stephanie Stewart. For those of you who I haven't met, I'm the Director of Philanthropy here at the Foundation. And before I turn it over to Mike, Marsh, will have a few remarks for us and introduce Dr. Eileen Consorti and John Russell. They're just kind of a couple of housekeeping tips. I almost feel like we don't have to do these anymore. We've been on so many virtual meetings, but we will have placed everybody on mute. And so if you have questions during the presentation, please put them in the chat. I will be monitoring the chat. And if you have technical difficulties, please call Gina Piper here in the Foundation, and her number is 425-688-5886. And now I will turn it over to you, Mike.
All right, thanks, Stephanie, and welcome everyone. First of all, let me start with an apology. I've been having gremlins in my Teams software all day, and so I'm calling in through my phone. Hopefully the audio quality is okay, and one of our staff members can let me know if that's not the case. But I know as much as you'd like to see my bright smiling face, I'm not able to get my camera to work. So my apologies for that as well. And I'll have to call our friends at Microsoft to see if we can get this figured out at some point. So welcome to another great program for Circle of Excellence. Today, our presentation is going to be devoted to our wonderful cancer center here at Overlake. And you know, this is a topic that's near and dear to a number of you. Many of you personally and directly were involved in helping us create the vision and raise the funds for this cancer center. In fact, for those of you that are newer, like Dr. Consorti and John to the organization, you might not even know that 50% of the cancer center was supported by our donors. So that's quite a fundraising goal. And it really is a tribute to the long-standing support that Overlake has received to develop our programs, but most notably for today's purposes, our comprehensive cancer center, treating the whole person from the diagnosis and treatment through recovery and into survivorship. So thank you to all of you for supporting this vision. I hope you enjoy hearing about what you've helped us to create from Dr. Consorti and John later today. But I do want to say your generosity doesn't stop at cancer services. Because of you, many of Overlake's world-class services are able to expand and grow for generations to come. And without you, it's not an overstatement to say that Overlake wouldn't be the world-class institution it is today. And then now more than ever, your engagement matters. I'm sure you've been paying attention to the headlines. Healthcare is changing at historic rates. New innovation and technology is approaching us at breakneck speed. And at the same time, economic challenges of supporting a large regional nonprofit referral center is becoming more and more difficult. And so we appreciate you, we thank you, and most of all, we need you. Without much further ado, I know you're much more anxious to hear from our speakers than you are me. So I want to introduce to you Dr. Eileen Consorti, who is our medical director of the Overlake Cancer Center, and John Russell, who is our director of the cancer care at the center. And they'll be providing the overview of the program today. You all know that in July of 2020, Overlake and the Seattle Cancer Care Alliance partnered to provide care within this new facility. And as I've said many times, it's just those of you that have heard me speak, while we're an independent hospital, we're interested in partnering with other organizations who are interested in the same goal as we are, which is to provide more and better services to the people of the Eastside. So that's kind of our partnership threshold. So now our speakers. Dr. Consorti is a board-certified breast surgeon. She received her medical degree from Loyola University Medical Center and completed her residency at the University of Minnesota Health, with additional residency training at the University of Texas and an oncology fellowship at MD Anderson Cancer Center. John Russell has worked in the field of oncology for the past 10 years, primarily in areas of strategic planning and innovation, Prior to joining the cancer program, he spent 6 years in New York City working at Memorial Sloan Kettering Cancer Center managing strategy. With that, I'll turn it over to Dr. Consorti and John. I want to remind you to submit questions in the chat along the way. And then finally, in addition to Dr. Consorti and John, I'll also be available for questions as well. So if there are questions that might be outside of today's presentation, or maybe that John or Dr. Consorti don't feel comfortable with, I'm happy to weigh into the Q&A session as well. So Dr. Consorti, John, the floor is yours.
Thanks. John's putting the slide up. I'd like to just start off with a few opening comments. First of all, Mike Marsh, thank you so much for your kind introduction. I'd like to thank the philanthropy team for putting this great event together. I'd like to thank John Russell for constructing the slide presentation and being the best dyad partner I could ask for. And last but not least, I'd like to thank all the donors who are present here today. If not for your kindness and generosity, we would not be here where we are today. And having said that, I would like to give the joint Overlake Cancer Center SCCA program update and future plans. So I'd like to introduce you to Kelly. And Kelly is here in the photo with his lovely wife and 2 loving sons. And this gentleman was diagnosed with a stage 4 colon carcinoma in late 2020. And if you all could think back to where you were in the fall, winter time of 2020, COVID vaccines were just starting to get rolled out. These patients were so nervous about coming to an institution to get their colonoscopies, to get surgery. And I have to say, he was frightened and he felt all alone. However, he would soon find out that he is not all alone. He actually had a great team behind him. The picture at the top to the right is Ms. Eileen Krause, who's a nurse navigator. And she's a SCCA navigator, but she works underneath the Overlake umbrella. And she was his first touch point. And she helped guide him through his initial diagnosis. She connected him with his appointments. The first appointment he had was with Dr. Ian White, who's a surgical oncologist through Overlake. He then had chemotherapy by Dr. Jason Comer, who's the medical oncology director through SCCA and works at Overlake, and had radiation by Dr. Brent Reese, who's a radiation oncologist under the Overlake umbrella. And I have to say, he did not feel all alone in his fight. He was able, and the best thing is he was able to receive his treatment near his home. And this was through a collaborative effort through SCC and Overlake. And it's one of the things that we can provide our patients. And while this gentleman may never be cancer-free, he knows now that he has the safety net of the cancer center underneath his feet. And having said that, we would like to talk about where we began, where we are, and where we're going.
Great. So Mike Marsh indicated already a few things that has been done in the past, and we kind of want to just share a little bit more about the past and where we began as a joint cancer program. In fact, I'm going to take you all the way back to the 1970s, and so just bear with me just for a moment. And the reason why we want to talk about the 1970s is that Overlake Medical Center around 1974-75 received accreditation through the Commission on Cancer program, which is one of the premier or top tier accreditation programs in the nation. And what this meant was that Overlake, they elevated or they met certain high standards that were set by the Commission on Cancer in the treatment of cancer patients. And to think about how Overlake, a hospital system in Bellevue, Washington in 1974 was able to achieve that accreditation was pretty impressive and just massively huge in the world of oncology, which also demonstrates that even back then, the leadership of Overlake really saw and had that foresight of building a strong and premier cancer program on the East Side. So if we fast forward just a couple of decades, Overlake continued to elevate their standard of care by receiving additional accreditations, one with the National Accreditation Program for Breast Centers and the other one with the American College of Radiation Oncology. This is just, again, demonstrating that their desire to elevate their standard of care to be one of the best here on the East Side. And then in around 2012, 2013, Overlake acquired OIMA, which was an independent medical group specifically for medical oncology. So this brought underneath the umbrella of Overlake Medical Center a group of medical oncologists. Overlake continued to receive additional accreditation designation, especially one designated as a lung cancer screening center, which is something that not every health system that has lung cancer screening has that designation. And then around 2016, Overlake and Evergreen entered into a strategic partnership where they were able to collaborate in areas of neuroscience and cardiothoracic care, which allows and improve access to individuals who have brain cancer and lung cancer in particular between our two organizations. And so this foundation that Overlake has developed over the decades, among many other things that they did that's not on here, really did culminate into what Mike was just sharing, which was the first integrated comprehensive cancer center on the East Side in 2017, which was, as Mike indicated, was a multi-million-dollar effort that really brought cutting-edge treatment for all types of cancer. And so I know that Dr. Consorti and myself, even though we weren't here back in 2017, we just want to express our appreciation and thank you to all of you who participated and supported the launch and creation of this, again, first integrated comprehensive cancer center on the East Side. So as we moved into the 2020s, we then saw Overlake continue its desire to really expand and grow with a collaboration with the Seattle Cancer Care Alliance in July of 2020. With a shared vision of providing collaborative world-class cancer care close to home. And that close to home tagline is really, really important here. It's really meant to focus on our ability to engage with patients that are as close to their homes as possible. And so this collaboration was meant to bridge the strengths of the Overlake Cancer Center with the strengths of Seattle Cancer Care Alliance and their affiliation with the Fred Hutch Research Institute to provide and continue to provide the best care possible. So in the 2 years since, we've done a lot, and we want to share with you what we've done. Well, there's two things in particular that we've done. The first is we've continued to build upon the foundation that Overlake Cancer Center created over the last few decades. And the second thing is that we've continued to, or have accelerated, the expansion and development of clinical programs and services to better support our patients. And so the foundation building has continued, even during the pandemic with the uncertainty that we had over the last 2 years with COVID. But in 2021, Overlake, very smartly under the leadership of Mike Marsh and John Duarte, the Chief Strategy Officer, continued their acquisitions of other practices, such as Washington Urology, where we brought on board urologic surgeons and experts in the areas of urologic cancers. Belgrove OBGYN came on board to Overlake, which opens up the opportunity to expand into women's health, in particular areas of ovarian cancer, breast cancer, and other gynecologic cancers. Overlake has also done a great job of recruiting top talent into our program, such as Dr. Jill Clark, who is an expert in colorectal and rectal cancer surgery, Marianne Vivian, who's an expert in cancer genetics. We've also added additional, even in the short 4 months of 2022, we've brought on additional experts. Dr. Prakash Gada, who's an expert in esophageal and gastric cancers. Dr. Margaret Mayo-Dusuwiski is an expert in skin cancer and dermatology. And we're adding on a fourth medical oncologist to continue to see growth in our medical oncology practice, Dr. Namrata Sethi. And of course, earlier this year, we've brought on board Dr. Eileen Consorti as our medical director for cancer services.
And I have to say, when you look at healthcare systems across the United States and progress made during COVID, hats off to Mr. Mike Marsh and John DeWarde for continuing on for program development. It speaks a lot for the Overlake system. So that was where we have been and what have we done to date. So the first thing I wanted to talk about is the nurse navigation program. Currently at Overlake, we have 2 nurse navigators, one that's employed through SCCA, Ms. Eileen Krause, and then one that's employed through Overlake, Ms. True Lee. Together and through collaborative efforts, they've navigated 600 patients over the last couple of years. And those patients are kind of a smattering of patients. 30% of them are breast cancer patients. About 40% have had GI malignancies, and 10% had head and neck cancers. It's the thought that we want to increase this program and hire, if not 1, 2 more additional nurse navigators to expand out the navigation to include lung cancer, urologic cancers, and then grow the breast program even further. The next thing that we've done is we've had expanded supportive care services. So currently we have 3 social workers, which has been expanded from 1 social worker. And these social workers work with people with new cancer diagnoses and explore their financial toxicities, seeing if they need spiritual care, and kind of help fill in the void that they may have. And I don't know how many of you read about how the prime concern for a patient with a new diagnosis is how much is this going to cost in healthcare today? So the social workers are really doing a great job filling in that void. Psycho-oncology, Dr. Kel Koenig spearheaded onc psychology program, psychiatric program, and Overlake is going to bring on a psychiatrist in June that specializes in treating patients with cancer diagnoses. So that's kind of a very good addition to our supportive care service program. Nutrition. We have an SCCA nutritionist and an Overlake nutritionist that work together and provide patients with appropriate diet plans during chemotherapy. I mean, a lot of times when you don't think about it, you just think I can continue on my same diet and still get chemotherapy, but that all has to be altered. And these nutritionists are doing a great job instructing the patients on what to eat and how to change their diet. They're also helping patients, our head and neck patients that are getting radiation, and helping them retain their weight and keep their weight on while they get head and neck radiation. And lastly, they're helping patients with weight loss because the studies are out and it shows improved survivability from breast cancer diagnoses after treatment if those overweight patients can lose their pounds, and that helps. We have a rehabilitation services. We have a massage therapist and a physical therapist that work with patients that have had surgery and radiation and get those patients going again in a forward direction following their diagnosis. So we do have all the supportive services that we need to have a very successful program. We have established a joint cancer research program through collaboration with SCCA. Currently, we have 5 open and active trials. We have 8 that are pending approval. We have 40 patients that are participating in the clinical trials. I have 2 of the clinical trials listed. One is called the PROMISE study. That's a nationwide registry of prostate cancer patients with germline variants. They get genetically tested through color and then enrolled in this registry trial. And then the second trial that's very interesting is the Hockenberry trial, and that's specific to the Fred Hutch Center. David Hockenberry is a research scientist that specializes in genetic and biochemical mechanisms of programmed cell death, apoptosis, for GI malignancies. And patients with GI malignancies can participate in this trial and get their gut microbiome DNA sequenced. So that's very interesting as well. And then a lot of questions donors have is, hey, does the community know what you guys have to offer? Are they aware of everything you're doing? And so I'm sure everybody knows that screening numbers were down during COVID. Women didn't want to come into centers to get their mammographies. People didn't want to get their colonoscopies, and those numbers across the nation look pretty dismal. So Overlake, for the last 4 months before the end of the year, started a 12-week campaign, Get Your Mammogram. And you may or may not have seen that on commercials or social media. But I have to say, early detection saves lives. And the last thing we want to see as cancer surgeons are women coming in with large breast tumors, node positive. So this was a really important campaign. There were 5.4 million digital impressions that were made from this campaign. 14,000 web views were seen on the cancer site. And lastly, I have to say the screening mammography numbers were never so good. They were actually better than the pre-COVID numbers, with a 26% increase in year-over-year growth. So it was a really successful screening campaign.
So as Dr. Consorti has kind of given a sense of some of these programs that we've established as a joint program over the last 2 years, we also want to bring to your attention of something that you're probably all very aware of. Earlier this month, the Seattle Cancer Care Alliance merged with Fred Hutch Research Institute to form the Fred Hutchinson Cancer Center, which is a whole new organization that really kind of brings together the clinical enterprise as well as the research enterprise under one umbrella, really one roof. And so then the question is, well, what does this mean for our patients? Ultimately, our patients will continue to see their same physicians and care teams here at Overlake SCCA. We don't see any changes to that at all. But what we see is that we're going to continue to expand our collaboration in the areas of education, training, and ongoing innovations that Fred Hutch is working on, as well as increasing our access to the clinical trials. Merging the Research Institute with SCCA is going to actually improve our ability to implement trials on site here at Overlake a lot quicker and get more of our patients who are eligible to participate to help in the discovery of new knowledge and research and so forth. So it's still very, it hasn't even been a month since this merger happened. So there's still a lot that we're working through, but ultimately we see this as a positive opportunity for a joint program as we move forward to really help accelerate our ability to engage with patients. And that kind of leads us to where we're going. So something that Dr. Consorti, myself, and the rest of the leadership team here at the joint program, we've taken time over the last couple of weeks to say, well, what have we accomplished, which is what we just described to you over the last few slides. But now we're taking a step back and saying, well, where are we going? What's the next 3 to 5 years look like? And what do we want to become as a joint program? And so as a consequence, we identified 4 principles that we are going to be guided by as we move forward. The first principle is be a destination of choice for cancer treatment. We are going to seek to become a regionally recognized brand that is top of mind for cancer care for anybody in our community or in the region who, if cancer comes in their life, we are top of mind for that. Be a patient-centric, innovative clinical and research program. As I mentioned, the increased collaboration with Fred Hutch is going to allow us to offer even more expert-guided offerings and services while also continue to accelerate the generation of new knowledge and discoveries and through the research opportunities. Being an engaged thought leader and partner in the community. We need to be more proactive, especially now as we're starting to emerge out of the pandemic. It's opportunity for us to get out into the community more and really build trusted, meaningful relationships that we had before COVID. And be a leader in fostering diversity, equity, and inclusion. We want to ensure that we are a welcoming environment for all and that we provide compassionate and respectful care for anybody in our community, any of our patients, but also for our staff members and our employees, ensuring that they have access and resources they need and are feel supported in providing the best care possible for our patients. So with that said, we do have several initiatives that we are looking to move forward with to kind of elevate and expand what we already have done over the last 2 years as a joint program. And we look at these initiatives across the cancer continuum in the areas of prevention, treatment, and survivorship. And we want to walk through each of these in a little bit of detail just to give you a sense of the direction that we want to go towards. The first one is a high-risk surveillance and management clinic. We want to become more proactive in engaging the community and identifying populations and individuals who are at elevated risk for developing cancer, with the primary goal of either preventing their cancer from ever occurring or to intercept their cancer at the earliest stage to maximize their chances of survival. And what the need is that there are tens of thousands of people within our community who are at high risk for cancer based upon certain risk factors, who don't even know about it. They're not aware that they're at risk, or they may be aware of it, but not sure what to do about it. And what we mean by risk factors, what we're talking about are factors such as like genetics, where people are born with certain genetic abnormalities in their DNA that disrupt the function of that DNA that then leads to cancer. Some individuals have a family history of cancer that they're at risk for, personal history, lifestyle, environmental, and these are all factors that lead to or at risk for hereditary cancers, secondary cancers, or tobacco-related cancers, among many others. And just to give you a sense of the numbers, we did a study here where we estimated that those who have a genetic cancer syndrome, just in our Overlake service area, we estimate it's almost about 10,000 individuals that we would love to be able to engage with more proactively. And so the opportunity for us is to establish an APP-led clinic. And APP stands for Advanced Practice Practitioner. And what that means is that this is an individual that has specialty training or advanced training in a particular field of health. So we're looking to establish this clinic to have an APP really engage with this population in a more proactive manner to monitor and evaluate them, to provide care coordination, personalized interventions, and improve health outcomes. And the value to the patient is that these patients will have access to experts in their specific area of risk, that will be a trusted partner that will manage their risks. The potential for research is huge in the pre-cancer space. And of course, for the patient themselves, this is about reducing their anxiety, leading to better health outcomes.
Okay, the next program I have to say is near and dear to me. I participated, helped develop a multidisciplinary breast cancer clinic in the Bay Area, and it was my thought and wish to bring it up to Overlake, because I think that the women with new diagnoses in the East Seattle community really need this. And it draws from a diverse group of specialists to create a comprehensive breast care plan formulated and communicated amongst the care team to the patient. I have to say, women have busy schedules. They've got kids, they've got a husband, they have tight schedules, they have sick others. And these women need a cancer program that specializes in breast cancer, supported by a strong care team. Women, they want health information, they want care, and they want it now. And breast cancer, the field itself is rapidly changing. It's a multidisciplinary field. It's not all about surgery. It's about collaborative effort between the surgeons, the genetics counselor, the radiation oncologist, the medical oncologist, the social work. It's a highly competitive market. So this multidisciplinary breast cancer clinic is a great way to deliver care. It allows a woman to bring in a sig other or a friend to be the extra eyes and ears for a morning appointment where they can be seen by a medical oncologist, a surgeon, a radiation oncologist, a geneticist, a social worker, all in one morning. It's a busy morning. That's why it's really nice if they can bring somebody else in to help take notes. It's great care delivery. It decreases wait times for these women to see specialists. It decreases trips to the clinic. It decreases excessive paperwork to be filled out. Hopefully, it will decrease the time from the initial diagnosis to the first step of treatment, which has been proven to improve survivability overall And most important, it provides a concise, organized plan of action to support their treatment. The biggest question I have from these patients is, these women, they're like, what's next month going to look like? What's the following month going to look like? So hopefully by the time they leave their appointment that morning, they'll have those questions answered.
Our next initiative that we're looking to establish is what we refer to as a whole person care. So Mike earlier mentioned about the idea of whole person care, and Dr. Consorti talked about and described how we've begun to expand our supportive care services and social work, psycho-oncology and medical nutrition and so forth. And we're at a point now where we want to take it to the next level, where we're proactive and utilize resources and tools and validation tools to really better assess and manage patients' social, mental, and physical health needs delivered through an integrated care model. And so the need that we have is that we have a growing population of patients who report a lot of needs and a lot of struggles and a lot of concerns. We did a study here where we found that even among our own patient population over the last 2 years, 40% of them struggle with physical health, such as pain, fatigue, when they're not in the facility. When they're just at home, they're having physical struggles. 24% of our patients struggle with mental health conditions, such as depression or anxiety. 35% struggle with social issues, such as food insecurity, transportation, housing, and financial toxicity. And so we've also done a gap analysis to look at other services that we provide either partially or not at all, such as integrated medicine, sexual health, and reproductive health. And so there's a lot of opportunity for us to think about and expand and establish a program to really evolve our relationship with cancer patients to care for the whole person across their cancer journey. So we know that radiation, surgery, and chemo are the standards of care for people diagnosed with cancer, but we also want to make it a part of standard of care. Any kind of social health interventions, mental health interventions, and physical health interventions based upon the patient's needs as they go through treatment. And so the value to the patients as we move forward in developing a program to serve and provide for this is that it's going to improve the quality of life during and after treatment. It's going to decrease the unmet needs across the spectrum of their health. And the last one's huge. This is going to improve the cancer treatment outcomes as a whole. There's studies out there that indicate that cancer patients who have mental health conditions such as depression, anxiety, they oftentimes have a lower adherence to the treatment regimens. They oftentimes miss more appointments than those who don't have mental health conditions, or they're not even taking their prescriptions correctly because they just can't handle the anxiety that is associated with their cancer diagnosis. So there's a lot of opportunity for us to establish this program and to meet these patients' needs in a proactive, earlier manner to really maximize their quality of life.
So we have this person with a cancer diagnosis who's gone through treatment. They've gone through their chemotherapy, surgery, radiation, and now they're done. And so what do? Well, right now we have a cancer survivorship program. John and I would like to broaden it up and kind of polish it up. There is a need in the community. We have hundreds of cancer survivors throughout our program, thousands more in the market who need a much better support system. Patients find the transition from treatment to post-treatment disjointed. Sometimes they have feelings of isolation, loss of connection. They were so well supported during their cancer treatment, and now what? And the transition back to their primary care sometimes is difficult. So we have an opportunity to establish a clinic to provide the support and management that these patients need as they transition back to post-treatment life. I always tell patients with a new diagnosis, you have the new diagnosis, you're going to get treated, and you may not ever go back to who you were before your diagnosis. We have an opportunity, needs assessment, education, care coordination, measure their outcomes. We have social work who do needs assessment when they first get diagnosed, and now they're going to go back and start doing needs assessment at the time of cancer survivorship after they're done with their treatment, kind of compare it, help them out. the value to the patient is through the clinic, the patients will have an improved quality of life and they'll learn what their new normal is, and that's okay. They're going to have reduced anxiety through relevant resources, proactive support to reduce the risk of cancer recurrence. So very, very important cancer survivorship. And then that takes us to our last slide, where I'd like to show you again the photo of Kelly with his wife and kids, and let you know that at the end of the day, it's through a collaborative effort by the providers, SCCA, Overlake, that we're able to give this care to Kelly. And it's with empathy and compassion and caring that we give to every cancer patient through our collaborative program, and to get them back to a new normal. And we want to thank you all for being here today. Thank you for being donors. And thank Mike Marsh for giving us the opportunity to talk. We'd be more than happy to provide you with our cell numbers to ask us any additional questions after the Q&A. If you think you're home, you're like, oh, I forgot to ask this, we'd be more than happy to be available to the donors to answer those questions. So thank you.
Great, thank you guys so much. So we have a couple of questions that were submitted in advance. So why don't we start with those? I also see that Leah put one in the chat. The first question is, what are the latest treatments for metastatic breast cancer?
Okay, I can man that one. It depends on what tumor type it is, right? Because now, as you know, it's all about tumor biology. And you can have the smallest tumor and it could be a mighty mouse. So it's all about what kind of tumor cells are showing up for that to create that metastasis. So the latest therapies, I'd have to say, are immunotherapy and targeted therapy. And for if you have hormone positive metastatic cancer, I would have to say the biggest advance that's been made is the CDK4/6 inhibitors, which is, I have arguments with the meta-oncs. Is it targeted therapy? Is it immunotherapy? Is it a combination of the two? But what essentially it does is it targets part of the tumor growth or the ability of the tumor to make another tumor cell, and targets what's called the cell cycle to stop that progression. So it's called targeted therapy, but that's the biggest for estrogen positive tumors. For the metastatic triple negative tumors, I think that the biggest has been immunotherapy. And what you've heard of in the papers and you've seen in the ads, Keytruda, Keytruda, Keytruda. If you watch Fox News, it's every other commercial, Keytruda. So I have to say that Keytruda has really made a difference for the PD-L1 triple negative cancers. And it's very interesting now. I have to share this story. I have a patient who had metastatic cancer. She had targeted therapy. She had targeted immunotherapy. She now, she was diagnosed initially with a stage 4 cancer. She never had surgery for her breast primary. And I have to say the surgical literature is going back saying maybe these patients need to get surgery for their primary now that their PET's shown stabilization of disease. We had another patient that was presented at tumor board who had isolated brain metastasis, and the neurosurgeons are saying, go ahead, resect it. Or isolated lung metastasis, go ahead and resect it. So all bets have been kind of changed and shifted with immunotherapy and targeted therapy. Thanks.
Thank you. And so just following on, you hit this a little bit, Dr. Consorti, but what potential treatments do you see coming down the road in the next few years?
The same, more targeted therapy, more immunotherapy. And when you look at the horizon, that's what they're doing, is they're fine tuning that. And the other thing that's very interesting is for the HER2 new positive tumors, oral Herceptin, and I think that's coming down the pike where they don't have to even come in for their infusions. They just take a pill at home. So I would really welcome that. And I think the patients would really love that. Not having to come to the infusion center, that's key, right? If they can take that pill.
Yes, thank you. Another question will we have SCCA prostate oncologists on the east side?
I can answer that one. So there are no plans to have an SCCA. Well, I guess the SCCA prostate oncologist. So there's you got the three modalities of surgical, radiation, and medical oncology. So we have our SCCA medical oncology practice here as part of the joint program, where our medical oncologists do provide medical oncology and chemotherapy for prostate cancer patients. And then through the acquisition of Washington Urology by Overlake, that brought on urologic surgeons, urologic cancer surgeons, Dr. Pham and Dr. Takayama. So that's really the prostate team is between our medical oncologists that already exists here at Overlake through SSCA, as well as the former Washington Urology practice that's now Overlake Urology Clinic, led by Dr. Pham and Dr. Takayama. So we have all that capability to provide the best care possible for prostate cancer patients. But there aren't any plans of bringing anybody from Seattle whose background is prostate to come out here. We've already got the experts here from SSCA as well as for Overlake.
Thank you, John. Let's see, in the chat, let's see. Well, and Mike Marsh adds in the chat, Overlake treats prostate cancer surgically and from a radiation therapy program augmented by medical oncology from SCCA, all right here at Overlake. Reiterating your response, John. So Leah asks, what percentage of patients get access to a nurse navigator now?
Good question. I don't have a percentage off the top of my head. Unfortunately, it's not every single cancer patient because we only have two navigators. But GI and breast are two top service lines. So I don't want to necessarily throw out a percentage, but I'll say something. It's more than half of our patients are getting access to the nurse navigation. And that's one of the reasons why we're looking to quickly expand navigation and bring on one or maybe potentially two navigators so that we can expand and have all of our patients that walk through our doors have access to nurse navigation.
Great, and maybe we can maybe do a little digging and get that answer out to folks too.
Absolutely.
Great. Then also, how would we go about attracting people in the community to the high-risk surveillance program?
Yeah, this is a great question. This is one where a strong collaboration with marketing as well as our outreach teams to engage in the markets can be critical. But from if you think about it from a business perspective, you got to think about the channels to market, right? Where you think about what are some organizations or groups out there that we can engage with directly to educate and promote this high-risk clinic. So thinking about local employers and some of these big employers in our service area that we can go and provide education around genetic testing and high-risk surveillance to kind of have a direct access to individuals that are interested in open to engage within the high-risk surveillance program. Certainly our primary care providers are going to be at the front end, a front line of really educating and identifying patients that walk through their doors, especially because most of these high-risk individuals are not going to be cancer patients. They're not diagnosed at that point in their life. And so it's going to be really critical to work closely with the primary care providers to be able to, ask the right questions, assess people correctly to ensure that we're identifying proactively those who may be at risk, and then do an assessment to determine what their risk may be actually is, and then providing the services as necessary. So there's a lot of different ways that we can approach to engaging the community and raising awareness, but certainly it's going to be a collaborative effort between marketing, outreach, and even on our business development side of really engaging organizations in our community to educate and make sure that the community as a whole is aware of this program to drive growth of the patient population.
And I like to tag on to that. John and I have already had preliminary meetings with marketing, and I had an hour-long session with one of the Microsoft physicians last week for an hour, and he expressed interest. Microsoft may be very interested in high-risk screening, so it's kind of out there. We're doing some preliminary road work right now.
That's exciting. Let's see, Mike Marsh also put in the chat that Overlake is also an early adopter in multi-parametric MRI for active surveillance of low-stage prostate cancer. So we are covering a lot of bases and looking forward to cover more. Are there more questions? You can also raise your hand and unmute yourself, or let's see, Jody asks, what are your thoughts about mitigating food insecurity for patients?
You want me to take that, Dr. Consorti? Sure.
You could take it, I could take
Sure.
it. We could
Yeah.
tag
So,
off on each other.
sure. I feel like I'm talking a lot. Yeah, absolutely. So when it comes to food insecurity, there's, we're looking to potentially establish more thorough partnerships with like food banks, food pantries in the community. One thing that I've been really impressed with Bellevue as a whole is that they've got some very, very strong and very well organized food support programs and community programs in our area. But there's a lot of opportunity for us to kind of improve or expand that collaboration, or actually create collaborations to really kind of support patients that have food insecurity. In my previous employer, when I worked at Memorial Sloan Kettering, they actually established their own food pantry specific for cancer patients that was in collaboration with the medical nutritionist. So that way, when patients are coming in, we're just not handing them food. It's making sure that we do it in a very thoughtful, meaningful way, where we're working with the nutritionist to make sure that we're giving them the right kind of food that they need as well. So there's a lot of opportunity for us to kind of explore and kind of expand on the idea of how we can kind of mitigate food insecurity. And our social workers are very much involved in that thinking, that discussion, as we start to think about not only food insecurity, but some of these other social issues that our patients are struggling with as well.
I have to say, at the old program that I was involved with, Safeway actually has a very generous grant that they provide to certain centers that you can apply for, where they will supply you with food cards to be used for food for women who are undergoing chemotherapy. It cannot be used on alcohol, of course, but it can be applied for food. And so I think that grant's very interesting, and I think we're probably going to pursue it up here. And you get these food cards for $50, $100, and then nurse navigators actually distribute those cards to the patients that actually have food insecurities. So that's a very nice program that's available to the community, and we'll probably pursue that as well.
That sounds incredible. Okay, are there any other questions? I'm going to bring myself back on camera here, share the screen a little bit with folks. If there are any more that come up, please do send them along. Thank you, Dr. Consorti and John and Mike. Thanks to everyone for joining us today. We wouldn't be able to be where we are without your support. And as Mike eloquently stated earlier, the support that you provide, not just to the cancer program, but to everything that we do here at this really terrific hospital. We're very, very grateful for our donors for their support. So we'll be sending out a post-event survey. Please fill it out. We do look at those. We value your input. We also love suggestions for future topics that folks are interested in hearing about. And you will get an email with this presentation. It's been recorded, so please feel free to share it with your networks if you enjoyed it, and have folks that you think would be interested in seeing it. And then finally, it's Bandage Ball season, and this year's Bandage Ball is unfortunately not in person. We are very much thinking that we will see all of you all next year in person, but please join us for the Bandage Ball online. It's going to run from May 7th to 14th. It's going to support Overlake's caregivers, and here at Overlake, we define all of us as caregivers and heroes because we all do work to take care of our patients and their families. So go to bandageball.org. There are going to be some great stories and videos A lot of fun. There's some wonderful things in the auction, online auction. And then there are just opportunities to support the hospital. So please check that out. Thanks again for joining us, and thanks to our presenters, and continue to take care of yourselves. All right, thanks and goodbye.